It's a pleasure to have you here.
Yeah, I'm
So,
happy to be here. Yeah.
we'll be beginning our session today. So, let me introduce you to our students present in this particular group.
Yeah, sure.
We have with us Dr. Garret Raja Immanuel. He is an assistant professor of English at Nazareth Margosius College in Pillianmanai, Tamil Nadu, where he has been teaching since October 2018. Before this, he served as an assistant professor of English at St. John's College, Palayamkottai, from August 2017 to 2018. Dr. Immanuel has made substantial contributions to the field of English literature and interdisciplinary studies with over 30 research papers published on various topics, including medical humanities, graphic medicine, memory studies, gerontology, and posthumanism. His academic journey includes a doctoral thesis on Gabriel Garcia Marquez's focused on existentialism, completed at Sarah Tucker College under the affiliation of Manonmaniam Sundaranar University. He is also noted for his presentations and invited lectures, having delivered over 25 lectures at various academic institutions covering a wide range of topics within the literary domain. Dr. Immanuel's scholarly works include articles on a diverse array of topics, such as Foucauldian critique of social constructions in Amish Tripaঠি's The Immortals of Melua, and explorations of ecological and gender issues in literature. So, without much ado, I would request our chief guest today, chief speaker today, to take over. And we are all excited to listen to him because the topic itself is very new to us. So, over to you, sir.
Thank you. Thank you so much for the generous introduction. I'm really happy to be here. And on the outset, I would like to thank Dr. Jasmeet Singh sir for inviting me here and giving me such a wonderful opportunity to meet you all. So I thank you once again. So the topic that I have been given or I have selected to present here is, as Sir said, it is a new topic. Relatively, it is a new topic in literary studies. Basically, it is an interdisciplinary topic, I should say. So before getting into the actual lecture, I would like to share my slides with you. Okay. Mm.
Listen to him because the topic itself is very new to us. So, over to you, sir.
Thank you. Thank you so much for. All right. So I think it is. Okay, it is visible to you, right?
Yes, yes, sir, it's
Yeah.
visible.
Yeah. So this is the topic that I wanted to share today. So discuss with you. It is actually an introductory lecture, a lecture to introduce a new topic called graphic medicine. So it is not actually new because people have been doing research in this area for the past 15 years. But in our area, in our for us, for Indians, it is a bit new. A bit new. So that is why I thought that I should be introducing this to you. And as the title suggests, this is a kind of a paradigm shift in literary and cultural studies. I'll be explaining why it is a paradigm shift in literary and cultural studies throughout this lecture. But before getting into the actual lecture, I would like to situate this particular area, that is graphic medicine, within another big domain. So actually it is an area, it is a subgenre of a very big field called medical humanities. So medical humanities, as many of you have heard of, or many of you would have seen or read somewhere, medical humanities is actually an interdisciplinary field. Basically, it is an interdisciplinary connection between medicine and humanities, that is arts, social sciences, and all that. So basically, when we talk about medical humanities, the history of medical humanities actually began after, of course, I'll be discussing the history with you when we get into the slides. But To give you a glimpse, a very short glimpse about medical humanities, basically, the proponents of medical humanities, they initiated a field called medical humanities to initiate a new connection between medicine, that is healthcare, and the the arts, basically the humanities. So it actually began with someone called Rita Sharon. So Rita Sharon was the first one who was talking about narrative medicine. Narrative medicine. Basically, narrative medicine is something related to literature and medicine. So that is not exactly literature, but what they consider as literature is something different. So anyway, so it is actually a subgenre of medical humanities, but nowadays they call it health humanities. Medical humanities is, of course, definitely it deals with medicine and humanities, but health humanities is more broader than medical humanities. Like it can cover everything related to health, right? Maybe aging, memory. Okay, so even post-humanism comes under health humanities, because sometimes those prosthetic limbs, prosthetic things, they can be situated under health humanities. So that's a very big area. And within that, we have medical humanities, and within medical humanities, we have graphic medicine. Uh, to simplify it, basically, it is a study of comics. What we are going to do is, of course, what I'll be introducing you is, I'll be introducing you a study, a methodology to study or research, uh, you know, comics, actually comic books, but it is not a simple comic. There is a difference between a very, the comic that we read in magazine and graphic medicine. Graphic medicine is a bit more refined. It is a bit more strategically written. So basically, it is most of the time graphic medicine texts are actually written by the patients most of the time. Like, of course, people are, there are different types. We have sometimes the patient, they write graphic medicine. If the patient is well versed in writing or drawing the comic, of course, that is autobiographical sometimes. And sometimes the caregivers, people who take care of those patients, and they write they write about their experience, how they took care of those people, the patients. Sometimes the doctors, they also write graphic medicine text. Anyway, the actual purpose of graphic medicine is to subvert the actual medicalization. Certain things are, of course, being medicalized. That may be a normal phenomena, but it is being medicalized. So it just wanted to subvert those things, those medicalized experiences, and it just wanted to make it look simplified. That is the actual reason of graphic medicine. Anyway, I'll be talking about that in the upcoming slides. So actually, there are some proponents of graphic medicine. There are some people, there are some doctors, there are some scholars, there are some caretakers, nurse, and all these health professionals are there. They are also under this particular um, area. Okay, they are also contributing to this particular area, and one of the persons is M.K. Zervik. Okay, a nurse, also called as comic nurse, right? So actually, she defines graphic medicine in the following way: the intersection. So she says the graphic medicine is the intersection between the medium of comics and the discourses of healthcare. Basically, it is an intersection. It is a connection between comic and healthcare. So what I was saying you a few minutes ago was the connection between healthcare and comics. Actually, it is most of the time it is it is written by the majority of the graphic medicine texts are actually written by the caregivers, because sometimes those patients, they can't write it. Um, they are suffering. Actually, they are suffering. They are not able to actually produce that. But by witnessing the struggles, the caretakers, they write. And one of the caretakers is M.K. Zervik. She is an actual nurse. I'll be talking about her works later, maybe in the upcoming slides. All right. And another very good definition given by the National Library of Medicine. So if you just Google it, you'll get a open the website of National Library of Medicine, you'll get the definition like this. They define graphic medicine is the use of comics to tell personal stories of illness and health. So they, from their perspective, it is something personal. So why should we tell the stories, personal stories of health and illness? The reason is health or illness or the struggle is not actually universal. That is one thing they suggest. They strongly believe, people, the scholars of graphic medicine, they strongly believe that struggle, the illness, the health issue is not something universal. Of course, you might have taken the issue of COVID, right? So during COVID, people, different people of different area, maybe of course, if let's say it affects 5 people in the same family, actually they didn't actually experience the same symptoms. All the 5 would not have been experienced the same symptom. One might be having a different symptom, another might be having a different symptom. So it is not actually universal. Illness is actually not universal. Of course, that is why it emphasizes the patients to tell their personal stories of illness and health, and that is one of the definitions given by National Library of Medicine. So first version is, of course, a version given by the caretaker, and second version is the version actually given by the the patient, actual patient, the personal story of the patient, right? And yeah, another important proponent of this particular area is Ian Williams. He's a doctor. Actually, he's a doctor. Okay? And he is the founder of Graphic Medicine org. If you really wanted to explore this particular area, and if you really wanted to be updated, up to date with the recent graphic medicine texts, actually, I will suggest you to open graphicmedicine.org. It is a very good website. It is a catalog of graphic medicine texts, and they'll be categorizing graphic medicine texts based on the illness, based on the disease, right? And Ian Williams was actually the founder. He was the one who initiated the website, and he defines graphic medicine in the following way. Let me read from the actual quotation. I quote: "The discipline could include graphic memoirs of illness." Okay, first one, graphic medicine. Now you know what is graphic medicine. It is a intersection between healthcare and comic. It may be the personal account of the patient. Now you know what is that. Now it is just a comic, I told you, right? But it is not actually just a comic. Okay, but here it might include graphic memoirs of illness. Yeah, we'll have some examples later. And sometimes it will include educational comics. Certain comics they have, for instance, in India, we have something called Menstruopedia. If you ever come across that, you might be knowing that. Otherwise, you can note it down, and you can explore that later. There's something called Menstruopedia. So Menstruopedia is actually an organization. Of course, they give educational pamphlets, educational materials for young girls and boys. They create educational comics related to menstruation and puberty and how would they feel. It's something educational material. So graphic medicine can actually include educational comics meant for education for both students and patients, academic papers and books. It can also include academic papers, also research papers, also books and gag strips about healthcare, graphic repertoires, and therapeutic workshops. Of course, everything that is related to comic can be considered actually as graphic medicine, okay, within this field. But when I talk about graphic medicine text, I mean the comic works that deals with experience of illness. That is something, particularly speaking, that is what I'm actually what I actually mean, right? So it can be actually fictional as well as non-fictional. So most of the time you might question, Can graphic medicine be only be a non-fictional real life story? No, no, no. It can be fictional. Sometimes it can be fictional, but most of the graphic medicine texts are actually non-fictional. They are real life stories. They are autobiographical in most of the cases, and sometimes it is fictional. Of course, it is possible. People can write fictional stories about the illness. Of course, they might have witnessed or they might have experienced. All right, that is another definition. So now I'm showing you two different texts, and first one is a very popular text about menstruation. So it is actually called "Go with the Flow." The basic story of "Go with the Flow" is there will be some girls, adult girls, and they're actually studying in a school. Okay, and in every page, when I open, actually I cannot show you the actual text. That's why I'm not able to flip the pages here. But anyway, if you open the textbook, the whole textbook is actually painted red, different shades of red. It is not only red. Now, you can question me. How can one person color a whole book with red? But it is red. Still, it is red. But still, different shades of red, like light, very light red color, and then a dark red, or sometimes a black mixed red, a brownish red, different shades of reds are there, right? So that is one methodology, that one narrative technique that the author has, uh, actually the writer has employed in this. And again, another text that I'm showing you here is Cancer Vixen. That is also another a very fantastic work. And these works, Go with the Flow or Cancer Vixen, these works, they belong to the category of educational, graphic medicine texts. They teach you about something. Cancer Vaccine is actually a story about a fashionista, a girl, a fashionista, and she suddenly gets cancer, and she is very afraid to have a surgery. And later, of course, she undergoes a lot of trauma, and then finally, comes with, he's okay with everything. So that's the actual story. So now the two texts, first one is about menstruation and second one is about actually cancer. So you might be questioning me, can we talk taboo topics here? Of course, sometimes certain topics are not, considered. It is actually considered. I should, put it into the inverted comma, considered as tabooed, right? So basically, graphic medicine texts are, considered a kind of paritopia. They call it paritopia, is a place where tabooed topics can be spoken or articulated. So that is kind of space, because sometimes people are not, they will not be permitted to talk about those certain things on stage, certain things on books. But sometimes, when they can draw it, people can actually do it, and it is not actually considered as taboo. So graphic medicine gives us a way to talk about those taboo topics, those topics that are not actually spoken elsewhere. That's one interesting thing about graphic medicine. Of course, that's some strategical problems within that. We'll be talking about the data. All right. So now you know that. And again, this is one more interesting comic. And I was writing a paper on this. I was writing research paper on this. Of course,
Oh,
students have,
sorry
um,
to interrupt you,
yes,
sir.
yes, sir, yes, sir,
The
yes.
50 is stuck on the first page, actually.
Oh, it's not moving, right?
No, no, no.
Oh, okay, okay, okay. All right, all right, all right. So let me stop sharing this. All right. All right. I'll be sharing it once again.
Okay, sir.
This time using my entire screen so that I can see that also.
Now it's visible, sir.
Yeah. All right. Now I'm moving the slide. So just let me
Ah,
know. Yeah, it's moving.
it's
All right.
working. It's working.
Yeah, 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 yeah. Okay, so this is what I was talking about a few minutes before. So, so go with the flow. And second one is Cancer Vixen. So I was talking about this, so I don't want to repeat it once again. But anyway, these are two interesting comics, graphic medicine texts, I should say. And now this is the COVID chronicle that I was talking. So this is basically not a single comic book. Okay, actually it's an anthology. When the comic was, the COVID was here around 2023, I believe. This book was actually released in 2000 at the end of the 2023. So by Penn State University. Penn State University collected a lot of comics related to COVID, and they just made it as a single anthology, and they published this. So I have shown you here one particular page from that COVID chronicle. But of course, if you flip through the pages of other comics, maybe other simple comic strips, or maybe sometimes the comic, the very short comics, you'll be witnessing various comics related to COVID, not only about the actual disease, but how the people suffered, or even the actual the time, the period when people were they were not allowed to come out of the house. They just had to be there inside their home. So all these things, all the problem related to COVID, everything, not only about the disease, not only about the death, but all the psychological problems were actually have been discussed in this particular work. So this is COVID Chronicle. You can also consider this as a graphic medicine, because it actually talks about it. The discourse is actually around COVID. That is why can also be considered. This is one of the kinds of graphic medicine texts. All right. So now moving towards another definition by Ian Williams, the first founder of graphic medicine. So he says graphic medicine combines the principle of narrative medicine. So now we must understand what is narrative medicine first, so that you can properly understand what is graphic medicine is all about. So now narrative medicine is something I was talking about. You know, in the beginning, I was talking about Rita Sharon. Okay, so Rita Sharon is actually a doctor, a physician, as well as a literary writer. She writes as well as she's a doctor, physician too, like Khaled Hosseini, right? So, so she actually initiated this particular concept called narrative medicine. According to her, the narratives of the patient should be collected, because most of the time the medicine, the medical field actually looks at the symptoms. It actually looks at the patient. It just checks the symptoms of the the patient, and then of course that's it. But actually we need to understand. We need to actually listen to the words of the actual patient. How do they feel both psychologically and physically? We need to understand that. So those whenever we listen to the experience of a person who is experiencing the illness, of course definitely they'll be narrating their trauma, narrating their sickness, through the words, like using, sometimes they use literary language, like I feel like 100 or 1,000 needles are pricking at my skin. This is a kind of simile, like okay. And sometimes they use metaphors too. So they use symbols too sometimes. So we can actually understand those narratives, all those narratives of the people who are actually suffering with some kind of illness, and it can be considered as a kind of literary text. So why should we read all those things? The basic concept that Rita Sharon was talking about is, though reading those narrative medicine texts will teach us empathy. That is the one thing which is lacking in the physician, she argues. Okay. And Rita says, she says we must read the narrative medicine. Exactly, narrative medicine is the stories written by, it is not actually graphic story. Okay, it is not a comic, but just a story, or the personal diary, the autobiographical materials written by the patients. So actually that is narrative medicine. That is not actually graphic medicine. It's just a narrative medicine. But here Ian Williams, he says graphic medicine should combine the principles of narrative medicine. Whatever the narrative medicine has, it should combine with narrative medicine with an exploration of the visual systems of comic art. Now, again, one more category, one more point of view is added. Here we have the visual systems of comic art. So we have to look at those texts, graphic medicine text, just like we look at narrative medicine text. At the same time, we must also explore the visual system, the visual semiotics of comic art. Okay, that is one thing we have to do. And interrogating the representation of physical and emotional signs. So, okay, so let me explain you what is the physical and emotional signs or symptoms within the medium. For instance, you can look at the picture here. So that's the final panel, the red panel. You can see this panel. This is something each and individual spire is actually called a panel, right? So now in the last panel, okay, you see there are so many knives there, okay, and there are two big bulging eyes, okay, and the face is actually in the color of red, and there is a dialogue box, okay, and it says, and then I found out that he is not just a breast specialist. Dr. Mills is the breast surgeon. Actually, this particular one panel, actually, it denotes the anxiety of the fashionista, the narrator, actually the protagonist of this particular work. Actually, it is taken from this particular page is taken from Cancer Vixen. I was talking about Cancer Vixen a few slides back. So actually, the fashionista, the girl who is who has breast cancer, and she's actually afraid of operation, surgery. So you can find how terrible it is for her. You can look at the eyes, you can look at the all the knives there, and again the actual font is, it is some kind of a horror kind of font. There are words like the knives, cut, blood, and all those words are there. So they actually suggest something. This is something which we call visual semiotics. Semiotically, they symbolize, they show that the patient is so scary. She is horrified with this particular act of surgery, right? So that is yeah, that is one thing we have to understand. So now coming back to the slide. So now again I'm reading the same definition. The graphic medicine combines the principles of narrative medicine with an exploration of the visual system of comic art, interrogating the representation of physical and emotional sign. Now, what I have just I have done was the interrogation of physical and emotional sign within the comic medium. So that is what I just did. All right. So now the next definition, of course, after the definition, I'll be talking about the methodological questions. All right. So now Michael Green is another proponent. So there are 5 people. Okay, they have written a work called Graphic Medicine Manifesto. That is one of the key works, seminal works in the field of graphic medicine. And in those works, of course, like Ian Williams or Sherwick, and like all of them, Michael Green is also a practitioner, a medical practitioner, and he says it is an approach to the education of health professionals. Actually, he's a teacher, a professor of medical college. So he says it is an approach to the education of health professionals as well as an emerging area of interdisciplinary academic study. So basically, he situates graphic medicine, just a comic written by the patient. Actually, he just elevates that comics to become an academic material, a study material. Particularly Michael Green's argument is, and like he says that those comics should be prescribed in the medical field for the medical student. Okay, so when we prescribe those materials to the medical student, definitely when they read the personal experience of the students, they will definitely have empathy over them. For example, doctors are usually critiqued by a lot of other, thinkers, scholars like Foucault, that they lack empathy. like the concepts of medical gaze. The very famous idea of medical gaze says that the doctors actually look at patients just like tables and chairs. They look at the patient just like objects, right? But sometimes they call them subjects, right? So, but actually they are dehumanized. The patients are actually dehumanized. So that is why Michael Green says that we must incorporate these graphic medicine texts within the curriculum of medical studies, so that the medical students or the health professionals, the future health professionals, will be having sympathy over the patient. They will be understanding the actual problem of the patients. So that is one thing. And again, another definition given by Susan Squire is graphic medicine is also a movement for change that challenges the dominant methods of scholarship in healthcare. Uh, you know, a few years ago, maybe even before 10 or 11 years ago, when I was trying to do something with literature, of course, I was writing a paper, I believe, and one of my teachers, and he told me that, Garret, you don't have to do this in literary studies. Actually, you're not a doctor, you're not a physician, so you're not, you should not do this in literature, he said. So actually, in those days, even before the publication of graphic medicine manifesto, people were looking for some serious kind of scholarship in healthcare. Of course, people, when we write something related to graphic medicine, and when we send those graphic medicine papers, research papers to uh, you know journals like Medical Humanities and all that, of course, people will be rejecting those papers. But nowadays, it has changed. It has become a part of medical scholarship. When people have, I have written a few papers on healthcare and graphic medicine. Like one of the papers argues that we have to incorporate graphic medicine text in medical curriculum, particularly when we talk about empathy, we have to do that. But anyway, that paper is actually accepted, by a very good reputed journal. Anyway, the thing is, it should be taken into the part of scholarship, medical scholarship, or healthcare scholarship. That is what Susan Squire is actually arguing. All right. So now moving towards the actual methodology, or the method of doing research in graphic medicine. So now moving towards the next slide. All right. So actually, this is one of the graphic medicine text. Basically, it actually talks about it. It is not actually, particularly, it is not talking about any physical illness. Okay, but actually, it denotes a discourse around hospital, which is basically the story Stitches is actually about a small a boy who is actually sitting. He's trying to sit in a particular place, and the nurse is there. The nurse actually comes out, and the nurse actually shouts at the boy. The boy is infuriated, and he goes somewhere, and after a few minutes the boy actually does the same thing what the nurse actually insists him not to do. So he becomes a bit rebellious. So that is why, through this particular work, the author is actually trying to convey that when you are inside a medical space, or maybe a space where people are treated, most of the time it it actually reveals the actual mentality of the patients as well as the caretakers. Most of the time the caretakers are, sometimes they are a bit irritated by small things, because they have been dealing with these patients and all that. And of course, not only about the caretakers, the patients are also being irritated by the behavior of the nurses, or maybe the healthcare. Sometimes we have to understand this too. So this particular one book, Stitches, is actually about the trauma that the people experience. So it is not actually um, mental trauma, but actually the irritation, how people becomes rebellion in their childhood and all this. This is one of the graphic medicine texts, and we must understand that graphic medicine is not only about the physical illness, but it is actually also about the mental illness also, the mental suffering also. Sometimes it may talk about depression. Sometimes it may talk about the mental problems like anxiety. Sometimes it may talk about like schizophrenia, people, problems like schizophrenia. So it may talk about mental illness also, sometimes madness, mental illness, right? So this is the actual story. So I have copy pasted few pages. So you can see how rebellious the boy has become after the nurse scolds him. At first, he's a very a calm boy, but later he does what the nurse actually insists him not to do. So he becomes rebellious. All right. So some of the characteristics of graphic medicine. So Susan Squire again says these comics give voice to those who are not often not heard. So it actually graphic medicine text gives voice to the voiceless people. Most of the time, when people cannot reveal or say or tell their struggles related to their personal sufferings, it gives a space to talk about their personal sufferings. For instance, there are graphic medicine texts that talk about STD, sexually transmitted diseases. So those texts actually, when someone writes those texts, imagine they are usually given the a space to talk about their own experience, they how they feel or how they suffer. But this particular, if they can write, or if someone helps them to write a graphic medicine text, definitely they can reveal their feelings, their traumas and all that. So it gives voice to the voiceless people, the people who are voiceless, right? And again, Ian Williams talks about graphic medicine as so too, graphic medicine resists the notion of the universal patient. I was talking about this earlier. So universal patienthood is actually a myth. He says, Ian Williams, one of the very good physicians, he says, so universal patienthood is a myth, universal illness is a myth. So of course, even if two people are suffering from fever, one is not experiencing the same symptoms of the other person, right? That is one thing we have to consider. So that is one thing. And vividly, I quote the text, vividly represents multiple subjects with valid, at times conflicting point of view and experience. Sometimes graphic medicine text, two different graphic medicine texts would be having conflicting points of views. So that is one thing we have to understand. So we have to listen to the stories of the people first. It is not something universal. It is not, no. When two people are suffering with stomach pain, or maybe a heart problem, they may not experience the same symptoms. Sometimes there will be conflicting points. We need to understand, because illness is always subjective, illness is always personal, it is not universal. We must understand. Of course, medical textbook says it is universal, but sometimes they may express a different symptom which is not there in the textbook. Something that most of them, that is the reason why it is so hard for them to diagnose a particular illness, right? So we must understand this through graphic medicine, through the narratives of the people. All right. Again, this is once again I have pasted some pages from the actual graphic medicine text. The second one is actually from COVID Chronicles. We just saw that, and the first one is actually also talk about of course the mental problems, the traumas. When you look at the pictures, you see how the actual person is feeling. The first picture, second one, third one, fourth one, they are constantly struggling with anxiety. They are constantly struggling with some kind of mental uh, dilemma sometimes, or sometimes they may be experiencing chaotic thoughts. And that is in writing, when they narrate that in with words, it is difficult for them to do that. But when they draw it, they can do that, because they use metaphors. Actually, when you look at these pictures, what they have done, those writers have metaphorically, drawn those figures. Like there are so many bubbles there. That means she's in confusion. And again, there is a circle. And again, so many words are there. So many people are there. Here is a monster on the right side. So monsters is a kind of metaphor. It's a metaphor. Actually, basically, it is simply a metaphor. So you see COVID as a monster. You see COVID with so sharp teeth, and blood is coming out of its mouth. So it is deadly. It is a deadly disease, definitely. But it is metaphorically illustrated. So of course, that is one thing graphic medicine is known for, because it gives space for doing it using metaphor, visual metaphor, we call it. Yeah. So now, again, Scott Smith is another scholar in graphic medicine. He says, another characteristics of graphic medicine. He says, so too, graphic medicine arises out of the discomfort with supposed techno-medical progress, working to include those who are not currently represented within its discourses. It actually includes the people who are not actually represented within the discourse. It is actually, we actually talked about it served as a voice for the voiceless people. It is again reiterated. And again, Kimberly Mays is another health professional, a person from the university. So he also says comics have often been associated with cultural change and are ideal for exploring taboo topics or forbidden topics. I was talking about this. They call it paritopia. Paritopia in Greek, or paros means a space where the anything can be explored, anything can be spoken. That is the space where you are given 100% freedom to talk about anything. So this particular space, uh, comics or graphic medicine, it becomes a space where you can talk about the taboo or forbidden topics. Like sometimes you can talk about sexually transmitted disease. You can talk about menstruation. There is a collection of comic called graphic reproduction. You can Google it later, right? Graphic reproduction actually talks about uh, you know things related to reproduction. That is, when how do people feel, and how do actually people experience the medical treatment for infertility or fertility, something related to that. And sometimes there is a collection of comics called menopause. Menopause, a comic discourse. That's the title of the sorry, a comic treatment. That's the title of the work. So those texts like menstruation comics, menopause comics, graphic reproduction comics. So they talk about taboo topics that can be usually spoken, or you know uh, they give a space to explore all these things, talk about all these things. There are, of course, comics of different uh, types. Of course, there are LGBTQ comics too. Of course, it gives a space to talk about those taboo topics, so-called tabooed topics, right? And this is MK Zervik's topic. Okay, MK Zervik was talking about that at the beginning of the presentation, and she is called comic nurse, and she actually talks about her own experiences from taking care of the HIV patients, right? So taking turns is actually all about taking care of HIV patients, right? And again, another definition by Kimberly Mayers: we want our work to challenge the accepted conventions of scholarship, he says, and merging the professional, personal with the pedagogical. So again, they note that, I'm sorry, they clearly note that those comics can be pedagogical. So they can be educational texts, they can be used in the classroom too, to inculcate some empathy of the empathy towards the patients, or maybe have the clear-cut understanding of the personal subjective experience of the patient. We need to have it. That's what Kimberly argues. And once again, I would like to show you another important work that is called Lady Doctor, and there is a parallel work, another work written by Ian Liv, that is called A Good Doctor. Okay, so A Good Doctor is actually a very good work. It is actually about a doctor. And lady doctor also. Lady doctor is also a very good work. So basically, two of the works, lady doctor as well as good doctor. So what they talk about is they talk about doctors as not superheroes, but doctors as human beings. They are also human beings. They are also vulnerable. They have some shortcomings too. So that is what Ian Williams is exploring in those works. For instance, in when we look at the work Good Doctor, in the Good Doctor is actually a person. At the beginning, if you read the work, the story is like this. So at the beginning, there will be a doctor, and he's a very poor doctor. He's not a very wealthy doctor, but whenever the patients they need him, of course he goes there, he goes through, he takes the bus and he goes there. Sometimes he doesn't get money from them, okay, and sometimes people are scolding at him. He accepts it, and sometimes he has his own dreams, his own problems. He has also some dramatic past. So basically, Ian Williams's work, the Lady Doctor as well as the Good Doctor, they explore, the vulnerabilities of doctors. So it also talks about the we have to look at doctors not as superheroes, but we have to look at them as human beings. They are also human beings. They need time to recover. They need time to take their rest. They have their own problems too. So, it is a kind of a reverse treatment. Like it gives the patient a glimpse that doctors also need, some kind of, they have to empathize with doctors. That's what it teaches. Pedagogical idea of behind Lady Doctor is we have to empathize with the doctor also sometimes. Because, during the COVID time, doctors would have also, they were working very hard. But at the same time, they are also human beings, and they have a family too. We need to understand it. We need to empathize with them. That is what Ian Williams is trying to say. All right. So now, coming to the heart of the presentation, why should we need, or why do we need graphic medicine? Why graphic medicine matters? So here you have a work on the right side. I have pasted the cover page of graphic medicine text called Marbles. It is actually a work which deals with depression. So basically, there are two important works that are there, very important in graphic medicine. They deal about depression, particularly. It is subtitled as Mania, Depression. You can read it here. Mania, Depression, Michelangelo, and Me. So it is about depression. So basically, graphic medicine text, they enhance, they actually focus on enhanced communication in the sense they actually reveal us so many things which can, yeah.
तालिया कहाँ है फोन देख रही है
Excuse me. All right.
Tasmia, I would request you to kindly mute yourself. Tasmia, kindly mute yourself. Tasmia, kindly mute yourself. Tasmia, kindly mute yourself.
Yeah, thank you. Thank you, sir. All right. So basically, the first important thing is it gives us enhanced communication. First of all, we can communicate our own diseases through graphic medicine. That is one thing. If you are the writers of graphic medicine or creators of graphic medicine, otherwise, graphic medicine gives us a clear-cut idea of how would the people experience, how do they feel it. That is one thing. That is why it is important. And second thing is it gives us empathy. It makes us stand in the shoes of those people who are experiencing the illness, and that is why it is needed. And the third one is it is sometimes used as educational materials or training materials. That is why it is important. And fourth one is, of course, it talks about taboo topics. Sometimes we can, or they may talk about tabooed topics which cannot actually be spoken in any other places. They can be used to talk about sensitive topics. That is why graphic medicine is very important. Now you know what is graphic medicine and the whereabouts of graphic medicine. Now we are moving towards how can we do research with graphic medicine, or how can we use it for the purpose of research, or how can we do research in graphic medicine. So this is the bad doctor I was talking about a few minutes ago. So bad doctor and lady doctor are two parallel works. Ian Williams. Okay, all right. Yeah, this is another important work, Monster. So Monster and Sick is another work of Gabby Skulls. So Gabby Skulls is not actually the real name. I'm sorry, Kendall is actually not the real name. Kendall is you know the pen name of Gabby Schultz. Okay, so he has talked about two different the problems. One is the problem with the state, and another one is the problem with the society. So this is in the first picture you're seeing a person who looks like a monster because he is green in color, but actually he gets herpes. So that is why he is colored as a green person. So people mostly they consider him as a monster, and they avoid contact with him because it is a sexually transmitted disease. And that is the story of monsters. And again, Sick is about a person who is actually alone, who nobody takes care of him, and he becomes bony. That's actually another important story. So, so this is something which I wanted to show you because these are some important texts within graphic medicine. All right. So now, again, another important thing about graphic medicine text is, of course, sometimes it is used for therapeutic benefits also. When people read about other people's experiences, for instance, you have a person who is undergoing cancer treatment, and he is reading the experience of another person who has successfully come out of that. And of course, when he or she reads the text, the experience of another person who has done the same thing, of course, definitely it gives them some kind of therapeutic benefits, psychologically therapeutic benefits. That is one thing. Again, it can be sometimes used as a kind of innovative patient care. Now, most of the time we read those texts, we come across different, accounts of the caretakers. So we can find the innovative patient care mechanisms out there. And again, another thing is, when people trying to talk about their own experience, for instance, I'm talking about Alzheimer disease memoirs, or dementia memoirs, or dementia graphic medicine text. So when people trying to express their own sufferings, their own problems, most of the people, they don't listen to this. For this, if they write that in a way that is attractive to the people, it reaches so many people. That is why it has been mentioned there that it has a broad reach and accessibility. Most of the people, they read if it is colorful, if it is so even children are really interested to read. Not only children, of course, comics, we all read comics, right? Of course, I read comics, you read comics, everybody would be interested to read because of the colorful pages, right? So it has broad reach. And again, the infographics of the specific clinical information can be folded seamlessly into a story. I give you an example. Okay, another example from Cancer Vixen. This is a page from Cancer Vixen. Actually, it is actually about the chemotherapy that she gets. So every time she gets a chemotherapy, it is being illustrated in a way that it is simply understood by a person. It is actually every single day she'll be given a certain amount of the chemotherapy that is illustrated. This is how they can sometimes incorporate complicated items into the comics in a lucid way. That is one thing you must understand. And these people are the major practitioners of graphic medicine. We were talking about, I showed you the definitions given by these people: Ian Williams, M.K. Zervik, and Susan Merrill Squire, Michael J. Green. These people are researchers. They write. They write comics. They do research in comics. And Ian Williams is actually a comic writer, and M.K. Zervik is actually another comic writer. Of course, all of them they can write. They can illustrate. At least they can write a script. So they are major practitioners. You can have can take a screenshot of it if you wish. All right. Yeah. And talk about the history of graphic medicine. Basically, graphic medicine, it started around 19th century when where people were talking about satirical cartoons. They were talking about they were writing low quality yellow paper comics those days. Sometimes, and when you look at the actual history of or comic studies, or maybe the comics at the beginning of the genre, okay, so comics were used just to mock the politicians. So most of the time it was satirical comics. They were satirical in tone. Okay, they used to mock the actual state affairs or mock the politicians. Of course, the author's names were anonymous in those days. And later, after that, people started using that around the world, you know, uh, it was doing the worldwide. It got some kind of prominence. And later, nowadays, after 2000 hundreds, I'm sorry, 2000s. So the growth of graphic medicine was, paramount. Graphic medicine. Uh, it was actually, I told you in the previous slide, I was talking about Ian Williams, and he was the one who actually initiated, he was the one who actually coined the name graphic medicine. And before that, it was just a comic. Until 2000 or 2010, it was just comic. And later, it became around 2005, I believe, it became graphic medicine. But later, after the first conference in 2010, people came to know about graphic medicine. It's a separate field, a separate genre in comic studies, particularly. So now there is another project going on. It is called graphic pathographies. Okay, and it is actually coined by, as you see, Miriam Solomon. So graphic pathography is actually a story. It's just a story, just simply. But actually, it actually talks about real stories. It is not actually comic, basically, but of course they'll be having illustrations there. But still, it is the stories collected from common people, the patients. So that is anthologized later. That is graphic pathography. It's a project, actually, basically. And again, when we talk about the actual difference between narrative medicine and graphic medicine, we must understand graphic medicine first. So I was talking about graphic medicine, but Rita Sharon, she defines graphic medicine in this particular way. She says, it is a medicine practiced with the narrative competence to recognize, observe, interpret, and be moved by the stories of illness. First of all, she combines medical practice with narrative competence. She argues that first, all the doctors, all the physicians should be competent to recognize, absorb, and interpret the stories of illness. When the patients, they tell their stories, most of the time those doctors, physicians, they don't listen to the stories of the patients. So they just skip it. Okay, I know all these. Okay. So she says the doctor should have the narrative competence. And again, medicine practiced with the narrative competence will more ably recognize patients and disease, convey knowledge and regard, join humbly with colleagues, and accompany patients and their families through the ordeals of illness. So a doctor must understand the narratives of illness. That is one thing she says. And these capabilities, I quote again, these capabilities will lead to more humane, more ethical, and perhaps more effective care. And she says, again, I quote, my hypothesis is that what medicine lacks today in singularity, humility, accountability, empathy, can in part be provided through intensive narrative training. So, according to her, all the medical practitioners should be given a narrative training in order to understand, like just like literary students, the doctors should be able to understand that first. Okay, so that is one thing, so that they can develop empathy over them. That is the argument of Rita Sharon, right? And there are some few key words, important, buzzwords related to this particular area. And first one is iconography of illness, okay, by Sander Gilman. So iconography, illness is of course image is talking about illness. Iconography is collection of images like symbols. Sometimes we use symbols to talk about illness. Sometimes we use some special colors to talk about illness. For instance, I was talking about a menstruation text like uh, "Go with the flow." Okay, at the beginning of the presentation, I was talking about "Go with the flow," and I told you all the pages were, in the color of red, like different shades of it. Sometimes it is brownish red, sometimes it is a black, mixed red, and sometimes it is very pink. Sometimes it is very light pink. So there are different shades of illness, different shades of experiences. That is what it symbolizes actually. So iconography is, of course, you can use those images. Icon is image, right? Images in such a way that it talks about illness. You can use different types of images, like sometimes we use symptoms, I'm sorry, symbols. Sometimes we can use some colors. Sometimes we can differentiate with its sizes. Of course, definitely we can do that. So that is iconography of illness. In different ways we can use images in the discourse of illness. And again, the second idea is illness as metaphor. I'm just moving towards second idea. That is Susan Sontag's idea of illness as metaphor. And before that, sir, how long can I talk, sir?
Uh, as you wish. It's very interesting, and we are finding interest in it. So
Yeah,
it's up.
yeah. So I think I can have a few more minutes, maybe 15 or 20 minutes. Okay, sir.
Okay,
Yeah, yeah,
okay,
yeah. I'll end before 8:30, I believe. Okay,
okay,
okay.
okay.
Okay, okay. All right, so the second idea, illness as metaphor. Actually, it is a critical text, okay, by Susan Sontag. You must be knowing Susan Sontag as a cultural theorist, right? So she actually talks about illness, using illness as a metaphor, seeing illness as a metaphor. She says, I quote from the text, my subject is not physical illness. She very clearly says at the beginning of the essay, it is a 14 or 15 page essay. So she actually says, my subject is not physical illness itself, but the uses of illness as a figure or metaphor. Most of the time, people use illness as a metaphor. My point is that, I quote again, my point is that illness is not a metaphor, and that the most truthful way of regarding illness and the healthiest way of being ill is one most purified or most resistant to metaphoric thinking. Actually, she is talking about two different types of illnesses. Number one is TB, tuberculosis. Number two is, of course, cancer. So she is actually a cancer patient. Okay, you must understand this first. And most of the time, she resists those metaphors used to denote the illness. For instance, most of the time we have heard of people talking about cancer as a battle and the patient as a warrior. She is fighting with cancer, people say, as if it is a battleground, as if it is a thing which is they have to fight with. Okay, but she says, no, no, you don't have to look at those things as metaphors. It is not at all a battle. It is not at all a fight. It is not at all, he is not at all a warrior too, but you have to look at it as a biological degradation or some kind of misfunction in the biology. That is something which you have to understand, and that's what she says. And again, she digs out some historical evidences, and she says, tuberculosis is usually when tuberculosis, TB was very uh, you know prominent during the time of 19th century. She says, in those days, people they thought that tuberculosis was when somebody gets tuberculosis, it was because of the excess of passion, excess of love. You might be remembering this. Keats also had tuberculosis. Stevie, he died of tuberculosis. People said, and of course, not only Keats, but the brothers of Keats also. One of Tom died of tuberculosis too. So now, coming back to the idea, so they point out that the people of 19th century, they believe that if someone gets tuberculosis, it is actually because of the love. The excess love results in tuberculosis. And again, there was a myth during those days that excess repression of sexual thoughts will result in cancer. So that was, of course, purely superstitious. But still, she says, you have not metaphorically mention all those things. It is not something illness should never be metaphorically connected. I would like to quote one thing from Gabriel Garcia Marquez's works. I did my PhD thesis in Gabriel Garcia Marquez, and Gabriel Garcia Marquez has talked about different types of illness. He has talked about cholera and love in the time of cholera. In one of the interesting scenes, the actual protagonist, Florentino, is actually he gets cholera. Of course, it is believed that he gets cholera. And the mother of Florentino says, "Oh my God, my son is actually in love. He has fallen in love, and that is why he has got cholera." That is, look at this. So now people have metaphorically connected love with cholera. In those days, people connected love, cholera with lust. In those days, so she actually says you should never look at illness as a metaphor for anything. So that is the argument of this particular person. And again, rabies is connected to when you read the love and other demons. That is the title of the work of Gabriel Garcia Marquez. If you have ever read that, you must have witnessed there is a girl, the protagonist, and the protagonist is bitten by a dog which has rabies. Okay, and immediately the bishop calls for the girl, and they term the girl as an embodiment of devil, or maybe she has been possessed by devil. So here, you can see when some dog bits a girl, okay, and she's considered as having rabies, contracted rabies. That is one thing, one side. But another side, the religious discourse, they term the girl to be having a demon inside her. That is another thing, another metaphorical idea. So now, that is what she says. She says you should never connect any illness metaphorically with anything else. If it is a disease, if it is an illness, it is just an illness. It is just a disease. That's it. And that is what she says. She is very clear in this argument. All right. So now moving towards the next idea. All right. Yeah. I quote from her text. So she says, cancer spreads and proliferates, or it diffuse. Tumors are surgically excised, and TB's association with poverty. Most of the time, those people on those days during 19th century, they associate TB with poverty. Okay, and lack, thin garments, thin bodies, unheated rooms, poor hygienes, and inadequate food. So she is against those connections, the metaphorical connection, like TB is associated with poverty and cancer is associated with excess of lust and all these things. So now that is, I give you one more example. I was writing another paper on this interesting work called My Degeneration. Actually, it is about a protagonist who is actually suffering from Parkinson disease. What is Parkinson disease, I believe. So Parkinson disease, of course, it is a neurological problem. The people who are suffering with Parkinson's, they lose their motor functions. They cannot move their hands or legs very quickly, how we do. Right? Their movements, it becomes slow, very slow. They cannot actually move, just like how we do. usually, right? So here the person has actually used metaphor. In the previous work, he has strictly says that you should not use any metaphor to talk about illness, but actually in graphic medicine it is very much useful or helpful to talk about those disease using metaphors. For instance, in the first picture, you can see you can see my cursor here, right? So in the first picture it is actually a comet is coming here. It is actually coming there, and he imagines, if some stone is approaching me, if some comet is approaching me, where would I go? Where would I walk? Because his movements are very slow. You can see the first picture, first image here. It is an image which is distorted in slow motion. Okay, look, it is a bit shaken, right? Because his movements is actually shaken. It is metaphorical representation of his own problem. The shaking picture is actually, that is how he actually sees the world, and that is how he experiences it. Okay, and again, one more metaphorical thing is, when he listens to when he first understands that he got Parkinson, he is actually broken into pieces. He metaphorically uses this picture to show that different pieces, one, two, three different. He is broken into three different pieces, three different words. Progressive. So first one is, it is progressive. Now in the uh, in few years he cannot be able to move at all. So that is one thing, that is progressive. And second one is disabling. Sometimes it can make him disabled. And the next one is, it is incurable. So these three things, they shatter him actually. So that is one thing. This is how strategically the author has used metaphors to denote his own experiences. One more thing is, of course, when you look at this picture, here there is a monster, a green monster. The green monster is actually the Parkinson disease. So actually, metaphorically, he says that he is fighting against the monster. It is a metaphor. Purely, it is metaphor. It is a visual metaphor. And of course, I have in my paper, I was talking about visual metaphor and visual metonymy too. But now, for your reference, I have shown you some metaphorical ideas, right? So here the monster is actually, the boxer is actually not a boxer. The opponent is not an opponent. And here another metaphor is there. So he metaphorically he says that it is like a race. Of course, we have to go, we have to run. So it is kind of a race. He's metaphorically meaning that. Again, one more interesting metaphor is that he shows that his own experience of having the Parkinson disease is actually like walking on the rope, very dangerous. Anytime he may fall, anytime anything can happen. And similarly, this is the second picture is from another work, probably from Mom's Cancer, I think. Yeah, it is from the Mom's Cancer. So here, in both of the works, the authors, they have used the metaphor of walking on the rope. They have compared those struggles, those situations, dangerous, precarious, vulnerable situations with the walking on the rope, the dangerous situation of walking on the rope. And again, in this picture, you can see in the second page and the third panel, okay, you have a picture where there is a crocodile, and if he falls down, the crocodile will eat it. So that's the kind of thing. And again, another problem, there is an elephant, and the rope is actually on fire. So the mom is actually struggling a lot. So all these metaphors, they project their situation, the situations of the patient. So in this case, when we read the graphic medicine text, we must read all those things metaphorically. Sometimes people use graphic medicine text to metaphorically express their own problems. Of course, metaphor is really good for expressing. We cannot just understand, oh, it is so I'm struggling a lot. If someone says I'm struggling a lot, I'm anxious, I'm traumatized with this, We will not be experiencing or empathizing with them. But when they project it using those metaphors, visual metaphors, definitely we will understand them. Definitely we will know, oh, how critical they are in critical, how critical position they are in, and we will understand that. So that is why it is important to know that. And now, analytical perspectives. How can we apply theories, or how can we look at all those graphic medicine texts using various perspectives? Okay, and there are so many perspectives. Okay, I'm not going to force every perspective on you, but of course there are some interesting perspectives too. All right. So yeah, I have 15 more minutes. All right. So these are three important seminal works in comic studies, basically. So these comics texts will be helping you to understand comics in a formal way, using formalistic technique. You can read villains. Of course, these texts are actually classic texts, very old texts. At the same time, they are powerful. There are some recent texts also, but still, you can use these texts to basically understand how comic works. If you want to give a formalistic reading of those texts, a textual analysis, if you are giving a textual analysis of those comics, you can incorporate the ideas given in those texts. For instance, I'll give you a few examples. Okay, so in actually this page has been taken from Understanding Comics, the first work, Scott McCloud's work, Understanding Comics, where he has talked about different body languages, body positions that actually show the experience, the emotions. So first one is anger, second one is fear, and third one is joy. Of course, there are other different positions. You can understand this first. First of all, you have to know this. Oh, this means this. So first one, surprise. If someone is surprised, of course, definitely they'll be using these, body languages. So that's something we have to understand. So we have to know this first so that we can apply all these things in the text also. And there are thematic analysis. Another important perspective is thematic analysis. Most of the graphic medicine texts, I should suggest you some important texts, some important researches in graphic medicine text. Well, number one person is Dr. Kamadkar is, of course, doing things with graphic medicine text recently, but Dr. Satyaraj Venkatesan from NIT is really a scholarly person in this field. And when you read the works of Dr. Satyaraj Venkatesan, actually he's a professor in NIT. He has done so many papers. He has written so many papers in this particular area. And when we particularly look at those textbooks, of course, those papers, he has actually talked about illness experiences or caregiving experiences and mental health problems. These are the prominent themes, the key themes in graphic medicine. Of course, medical ethics also. He has talked about what is ethically right, what is ethically wrong. Talking about abortion is also there in menopause. Our graphic reproduction. I was talking about graphic reproduction, a textbook that has a collection of comics related to reproduction. So it also talks about whether that there is a comic in the collection called Abortion Eve. So it actually talks about the experiences of abortion. How does a female feel during the abortion process and all those things. So what is ethically right, ethically wrong, and all those things can be considered. And again, health policies can be criticized. If you write a paper on an issue, definitely you can go for that too. So these are unexplored areas, some kind of unexplored or less explored areas. I should say this. You have to always search for the research gaps in the field. Most of the people, when they write papers on graphic medicine, they of course go for formalistic elements. There are so many journals like graphic, comics and uh, graphic narratives. That is one of the important journals in this field. Okay, so when you read the actual published works in those journals, or maybe the particular journal, you may be looking at different texts that are formalistic. They have done formalistic understanding, they have formalistic research in those comics. But of course, you can also do a kind of qualitative research. Actually, you can also do a research that criticizes the health policies, or you can advocate for something. That is, there are different ways of doing it. All right. And now, again, when you look for other possibilities of doing that, you can also go for the text that project the disability. But one thing is, very familiar with literary students. That is, disability studies are different. Of course, it comes under this category called medical humanities. Okay, but particularly we are focusing on the disability represented in the comics. Of course, there are different ways of aesthetically or different ways of showing disabilities in the comic. You can also go for that. You can also do a research on that, or you can also do a research in patient-doctor relationship in within the the graphic medicine, within the comics, or how the aging is represented. There are some narrative strategies, aesthetic strategies, representation strategies out there. So you can also look at the trauma and recovery, how the mental illness has been represented. So these are different ways of doing things in graphic medicine text. But particularly, there are some popular areas, the depression, anxiety, or mental problems, autism, and these areas are less researched in the actually graphic medicine area. But of course, still it is so popular. People read a lot. The people are actually reading a lot of text related to depression, anxiety, dementia. But at the same time, research, very less research is there in these areas. So you can do that. And again, women's health and gender issues also another popular area. But you can also do that if you wish. Or like there are some works, graphic medicine text about eating disorders also, infertility also. You can explore that. Of course, I suggest you to check graphicmedicine.org, the website which is dedicated for this purpose. So instead, you are looking, if you are a literary student, a student who is doing literary studies, instead of going for some literary work to do the same, you know, a kind of research like post-colonialism, feminism, and all those things, you can give a try to these areas. Of course, one of my students is doing a project in using graphic medicine text, and he's actually doing things with Ian Williams's text, right? Okay, all right. So now this is another area, and again, pandemic and public health. There is a collection of comic called Public Health Comics, Public Health Narratives. You can Google it. It is also published by Penn State University. A blue color book. You can see the cover page is blue in color. Yeah, that is a wonderful text on public health. Particularly, you can do a research with that too. It will have a collection of comics. All right. And again, you can critique the neoliberal policies too, the state policies and all that. You can do that. All right. And there are some theorists also. You can apply some theories of. We are talking about Susan Sontag and Rita Sharon, Michel Foucault's idea of medical gaze, how doctors look at patients just like objects. That is the idea of medical gaze. And Nicholas Rose is another prominent medical humanities scholar and theorist. He has talked about neurochemical cells. He has also talked about so many other ideas like medicalization. Very interesting people. And Arthur Frank is another important person in medical humanities. You can use those theories. You don't have to restrict yourself with these theories. You can create your own theory. If you find a pattern within those texts, if something is very common in all the texts, you can figure it out. You can just put it, take it out, and you can create a theory out of it. And of course, you can come with a new terminology, right? So that these are different ways of doing research in that. Yeah, and this is another one more excellent text in theoretical text related to medical humanities, written by Arthur Frank. Okay, so basically, I don't want to talk about that, but basically, the work actually focuses on why should we tell stories? Why should a patient tell stories? I just read the actual quotation from the text. This is the actual quotation from the original text, Wounded Storyteller. So he says, the author says, as wounded, people may be cared for, but as storytellers, they care for others. The ill and all those who suffer can also be healers. Though, so one thing is, he's trying to say that the people who are suffering, they can also be healers by telling their own stories, by expressing their own traumas. They can be healers. I quote, their injuries become the source of the potency of their stories. Through their stories, the ill create empathic bonds between themselves and their listeners. These bonds expand as the stories are retold. Those who listen then tell stories, and circle of the shared experience widens. Actually, there are different texts. There are different texts about trauma. Trauma studies. Carrie Coran's ideas. When you look at Carrie Coran's idea, basically, she says that the wounded body, or the suffering body, should tell stories. It There is a necessity to tell the stories, because it when they express that, when they tell their own suffering with others, definitely it will be it has some healing capacity. When they express their own suffering, they feel relaxed. And of course, when they share the same stories with other people, and an empathic bond between themselves and the listener is established also. So that is why it is important to tell the stories. So that is why Arthur Frank says that a wounded self should tell the stories to others. That is one thing you need to understand, right? And there are different types of narratives. With this, I would like to we have come to the end of my presentation, and there are two different types of illness narratives. Okay, number one, first, of course, there are three types actually, but I have talked about two different types in my slides, in my presentation. So one is a restitution narrative. So restitution narrative is an illness narrative, but it has a positive ending. Of course, at the beginning, the narrator is actually suffering, or the protagonist is suffering with some kind of illness, and at the end, it comes out without, he has a resolution, a positive resolution. He has fought with the disease, and he has recovered from the illness. That is the restitutive narrative, one kind of narrative. Another narrative is chaotic narrative or chaos narrative. Chaos narrative is actually, it talks about the problem, the mental confusion of the narrator or the protagonist, right? So most of the time when we read the narratives of the patient who are suffering with schizophrenia or mental disorders like depression, or sometimes anxiety. So they usually they have chaotic narratives, chaotic, as they are anxious. So they have chaotic narratives. It is not coherent. Sometimes you may think the narrative itself is chaotic. And again, the third one is quest narrative. Where I was talking about a story with Parkinson's disease. So that is actually a quest narrative. So the person is actually, he keeps on trying to, manage Parkinson's disease. So this is a kind of quest. So it is a kind of journey. He's trying to, come out of that. It actually tells the story of a personal growth or maybe transformation. So that is what we call quest narrative. These are different types of narrative. So whenever you look at those stories, you'll be having these different, three different types of narratives as well. So till now we have talked about graphic medicine. We have talked about different ways of doing research with graphic medicine, different theories to apply, or maybe creating your own theories, and different types of narrative techniques used to compose or create a graphic medicine text. With these ideas, whenever you try to read a graphic medicine, or maybe you try to read a comic that deals with illness, you apply all these things. You have to have a clear-cut idea of that, so that you'll be getting at least the best out of it. You can do that. You can actually realize what the author is trying to say, or what the narrator is actually trying to convey to the world. So with this, I would like to conclude my presentation. So now it is time for question answer. So if you have any question, you can ask me. Yeah.
Thank you, sir. If anyone has any question, it was a wonderful lecture that we had. Uh, we were enriched. I think he has opened up possibilities of research. He has talked about the fields in which your students can actually work upon. So, if you have any questions now, you can ask him.
Sir,
Yes.
sir,
Huh.
I have a question.
Okay.
Oh,
Yeah.
So, does graphic medicine disrupt the authority of clinical objectivity by privileging the patient's or reader's visual and
Yes,
narrative
yes,
voice?
yes, yeah. That is one thing about graphic medicine. Basically, that is what those
There is a
practitioners,
sudden
those
disturbed my mind.
researchers.
That's why I'm
Yes.
asking.
Yes, especially graphic medicine is, it actually tries to give the privilege to the stories of the patient. Particularly, the main critique of graphic medicine, all the practitioners, all the researchers, all the scholars in graphic medicine, is they argue that the actual medicalization, the actual the field of healthcare, they neglect to listen to the stories of people, the patients. Particularly, different patients, different people have different experience of their illness. So basically, it is when it is universalized, we do not listen to the subjective experience of the people. So graphic medicine is actually, it is the actual, no, the purpose of graphic medicine is to bring out those stories, bring out subjective experience of the people. Yeah, definitely it disrupts. Yes.
I hope this
Okay, sir,
answers your.
thank you. Sir, I
Uh, hi, Farhan, you have a question? Farhan, you have a question? Kindly, we can't hear you.
Hello.
We can hear you.
Thank you, sir, for such a clear and engaging session. I
Mhm.
really like the way you connected graphic narratives with cultural studies.
Mhm.
My question is, most of the work on graphic medicine comes from the West. Are there any examples from India or South Asia that could add a new perspective to the field?
Yeah, there are a lot of research papers coming out of India. Basically, of course, those texts. So we do not actually have writers who, comic writers who actually write comics. But still, as I was talking about Menstruopedia. Menstruopedia is an Indian initiation. It is an Indian initiation where they talk about things like menstruation, puberty, and other things related to men health issues. Like that is something which is Indian initiative. But of course, still there are very less possibilities. There are less work of what's are comics from India. But there are so many scholarships from India. Of course, so many people have written papers from India at this side, you know, our side. So yeah, there are so many things, but still, you can also do a critique of those works. But if you really wanted to have an idea of how people express, how people, of course, still there are so many narrative medicine texts are there. For comic texts are very less, but at the same time, we have so many narrative medicine texts are there in the form of memoirs. Actually, you can also do things with that. Okay, that is actually not graphic medicine, but there is that's what something we call narrative medicine. People have written about their own problems, their own struggles, how they come across all these things, and they have written about that, and they have published that. There are so many memoirs from India, of course, about their one personal sufferings. You can also do research with that too.
Okay, sir. I have another question.
Mhm.
Do you see graphic medicine influencing public health awareness or policy making in the future?
I'm sorry.
Sir, my question is, do you see graphic medicine influencing public health awareness or policy making in the future?
Definitely, definitely, definitely. Not right now, but anyway, in the course of time, definitely it will have impact on policies. It will definitely have, it will definitely influence people's awareness. This is the beginning of graphic medicine. Nowadays, we have, as I said, it is a new area. Still, it is a new area. People know very less about this area. When it is being popular in the next 10 years, it will definitely, I believe, because I have been doing research with this particular area for the past 5 or 6 years. Of course, there are some prominent researchers out there. Like I was talking about Satyaraj Bhattacharya sir. He's a pioneer in this particular area. So of course, in the next 10 years, people will definitely have, this field will enlarge, and definitely people will realize this, and it will definitely have an impact on policies. Definitely, yeah,
Sir, I have another question, my last question.
yeah, yeah.
How does graphic medicine function as an alternative space for marginalized patient narratives? And in what ways does it subvert the silence often present in the mainstream medical discourse?
Yes, yes, yeah. I was talking about paritopia. Paritopia is a new idea, a very recent idea. Okay, so where people say that graphic medicine gives a space to talk about those people, are the to voice for those voiceless marginalized people. But particularly when you talk about marginalization in the context of context out from, apart from medical treatment or health discourse, of course definitely comic has that capability. Comic can be a space where you can talk about marginalized people. You can talk about the actual oppression done to the people. Of course, definitely comic is a very good medium, but when it comes to healthcare, when it comes to medicalization, definitely it gives voices to those oppressed or marginalized people. But of course, definitely comic can be a medium, a very good space to talk about those things also. Yeah.
Sir, I have a question.
Hmm. Yeah, yeah, please. Yeah, what's the question?
What is the question? Uh,
Sir, what's it? Hello, am I audible?
Yes, yes, you're audible. You're audible. Yeah.
Sir, what is the basic difference between quest narrative and restitution narrative?
Okay, so quest narrative is actually, you do not come to a conclusion actually. So it is still a quest, it is still a search, it is still a journey. At the end of the comic, you will not have been, you would not have reached the conclusion whether the patient has healed, he has healed or he has been cured. No, it is not stated there. That is the quest narrative. But the first one is actually restitution narrative. Is actually, it is about the end. Finally, of course, it has a triple S formula there. So first one is they situate the person within an illness. Okay, then they struggle. It is also mentioned there. And at the end of the comic, you'll have the success story. He would have healed, he would have been healed, or he would have been cured, and he has come out of that the disease. So he gives the testimony. So that's the difference between them. Yeah. Quest is, it is not ended, it is still there. It's still a journey. But the first one is, of course, they have successfully come out of the disease. Yeah.
Okay, sir. Thank you. I understood.
Yes, yes.
any more question? Acha. Okay, I suppose.
Sir,
हाँ हाँ Farhan.
Yeah, yeah.
sir, my question is, with the rise of digital media and AI generated illustrations,
Hmm.
how do you how do you see the scope of graphic medicine evolving beyond traditional print comics, and what new possibilities or challenges might this bring to the field?
Okay, so actually AI, and you can create a comic using AI. That is one thing, we all know. Of course, I have created my own comics for my students using AI. ChatGPT can create a comic. Of course, we can then first you can do the picture, and then you can write the story. Definitely, it is a good thing, but at the same time, it is threatening to the writers, actual writers, because it is actually erasing. It is actually, kind of. I think it is some kind of mimicry or some mockery kind of stage, where the actual writing, the actual talent for creating comic is being mocked. I see it in that way. It is it's something Frederick Jameson says. When we read Frederick Jameson's works, he actually talks about three different qualities that the digital art lacks. Number one is digital art lacks depthlessness. There is no depth actually. Of course, you give a prompt, you make ChatGPT or Gemini to create a picture. Of course, definitely it can create a very good comic, exactly like what we have seen so far. Definitely, I have done that. I have used that. Okay, but at the same time, when you publish that, like as saying that you are an author, definitely it questions. It actually it terribly it mocks at the actual talent, that the people who can write it, who can illustrate that. So that is one thing. But still, we have to understand that it lacks depth. Number one, Frederick Jameson's idea. Number two, it actually lacks some kind of authenticity. There is something called aura. The actual aura should be there, because every single pen stroke has an aura, but still a brush stroke has an aura. But still, here it is not there. So definitely, of course, he can create, but definitely it will definitely lack some kind of authenticity in it, some kind of realistic authenticity. But you cannot situate that within single comic. If you compare 100 comics created by ChatGPT, definitely you can have a pattern there. That is something which shows that it is not original. It is not actually original, because it is something, the same pattern is actually repeatedly. If you can create sentences using ChatGPT, you'll be frequently seeing the word delves into, or interplay, or complexities. So these are the patterns. This is how AI, the AI detectors, they find that they find whether it is an AI generated work. There is a grammar grammar of AI particularly. So when you do that constantly, definitely you'll find it. Yeah, that is what I say. Even if you can create a comic book using ChatGPT, most of the journals nowadays, they acknowledge, they want you to acknowledge that the thing that we have used those uh, you know technologies, AI or ChatGPT or any kind of AI, in creating those comics. If you acknowledge, definitely that is documenting actually. That is how we have to do that. Otherwise, you don't have to do that actually. If you are doing something with AI and saying that it is my comic, it is not actually your comic. It is not our comic. It is AI generated, still an AI generated, and that is still a plagiarism. So I think in future people can create that for their personal use, just like what I did. I created a whole comic using ChatGPT for the personal purpose of showing my students, because to intriguing my students, to uh, make them listen to me, or make them look at the screen. That is different purpose, of course. But you cannot claim the that it is your own comic. You're not the author. You're not the illustrator. You're not the actual person who created it, right? Yeah.
Okay, thank you, sir. Thank you.
Thank you. Thank you so much.
Okay, the last question, we'll be taking a last question. Dependu, if you have any question.
Yeah,
Sir, am I
we have.
audible?
Yeah,
Yes, yes.
yeah, you're audible. Yeah.
Okay, so first of all, thank you, sir, for introducing us to the diverse roots of graphic medicine with different works of medical humanities. So, sir, my question is, what liabilities do graphic medicine creators bear while discussing topics such as trauma, addiction, or terminal care?
Mm-hmm. Can you just repeat the question once again?
Uh, Sir, my question is,
Hmm.
what liabilities do
Hmm.
graphic medicine creators
Hmm.
beer while discussing topics such as trauma, addiction, or terminal care.
Okay, okay, okay. Particularly when the creators talk about trauma or depression or any kind of mental illness, they basically first of all, first thing is those experiences like trauma or depression. That is actually most of the time, when the writer writes about those things, they are actually uh, the personal experience, most of the time. Of course, I have read so many autobiographical accounts of trauma, and particularly depression or mental illness, or other type of anxiety related things. Of course, particularly they are having their own experience of that thing. Okay. And secondly, when we talk about when they talk about their personal experience, like most of the time they do three things, different things. First thing is, of course, they are trying to make you empathize with them. They want you to stand on their shoes and look at the world. That is one thing. And again, the second one is, of course, they are trying to give voices to the voiceless people. That's the second thing they are trying to do. And third thing is, they are trying to challenge the actual convention. The already the field in the field, there must be some conventions about depression, trauma, or maybe any kind of mental problems. So when they are talking about that, they are trying to challenge the convention actually, by merging their own personal experience and making it. Sometimes they, certain times there are some texts that are talking about their personal experience, as if the narrator's duty, he assumes it as a kind of a pedagogical kind of, to teach others about his own problems, teach others about this particular illness. So this is where they challenge the conventions by merging their own personal experiences with pedagogical, or the subjective with objective. And these are the three things they actually take care of. But particularly when we talk about the legal liabilities, particularly, they have some kind of ethical consideration. Most of the time when they talk about their own experiences, of course they can talk about that. Still, whenever they talk about their own personal idea, their own personal experience, personal trauma, of course they don't have to account for anyone. They can write it because it is their own personal things. But when they talk about the trauma of depression of any other people, of course definitely they will have to have some ethical clearance. So that is one thing. Or they must be talking about the actual person who experienced that, and then acknowledge that. Sometimes, okay, sometimes of course the person is not interested, you can they hide the actual person's name. So that is how they do it. So basically, most of the time, these are the three different things that they have in mind. And of course, definitely, if it is their own, if it is their own personal idea, if it is their own personal experiences, of course, they don't have any legal liabilities. Particularly, they can go for it. They can write it.
Okay, sir. Thank you for the information.
Thank you. Thank you.
Sir, I have a question.
Yes. Yes. Yes.
Ahuna, this would be the
Can
last one.
I ask you?
Hmm.
Okay, sir. So my question is, what form of knowledge do graphic narrative produces about illness that
I'm
traditional
sorry. I'm
clinical
sorry.
narrative
Your voice is
cannot? Can
breaking.
you?
Can you just? Your voice is actually breaking. Can you just repeat it?
Oh, okay, sir. What
Hmm.
form of knowledge do graphic narrative produce about illness that the traditional medical narrative cannot?
Okay, what kind of knowledge that it can produce that which cannot be produced using?
What form of
Traditional
knowledge do
method.
Uh, okay, traditional text,
graphic
traditional.
narrative produce that traditional medical narrative cannot?
Okay, that is one thing I was talking about in the I think in the first few slides. That is inculcating empathy. So basically, that is the problem with, that is why we have graphic medicine. Because most of the time people, one thing is, of course, medical normal medical practitioners, normal the students of medical studies, of course they lack one thing called empathy. That is one thing that all the other researchers like Rita Sharon and Ian Williams and all these people say. So that is why they wanted to make it a pedagogical tool. So graphic medicine is not just the graphic medicine to the actual purpose of graphic medicine is not to entertain you. The actual purpose is to educate you. That is one thing. So basically, by educating you, it actually gives you a kind of understanding about what is universal patienthood. Is there really a universal patienthood, or it actually questions the subjectivity over objectivity? Otherwise it can sometimes focuses on the personal very personal experience of the patient, so that we can this is something is lacking in actual medical practice. And that is why we need to the traditional medical knowledge lacks it. That is what the graphic medicine is trying to give, giving the personal experience and making you understand their struggles from by standing on the issue. That's it. That's empathy. Empathy is the answer. Yeah.
Okay.
Okay, sir. Thank you.
Okay. So here we come to the end of our question answer session. I would request, sir, to kindly share the PPT if you can with me,
Yeah,
so that
sure, sir, sure, sir.
okay.
I'll definitely share with you, sir. Yeah.
They are actually messaging me on WhatsApp to ask you for those PPT.
Oh, okay.
So
Okay, sir.
before uh,
Yeah, I will share the PPT with you, sir.
before we end this, first of all, I would like to thank S. Janita Man. She's a research scholar, APC Mahalakshmi College for Women. She was the one who has actually connected us to Sir, our chief speaker for today. I'd request Janita ma'am to kindly say a few words if she's available. Janita ma'am, are you there? Janita ma'am, are you there?
Yes, ma'am. I'm here. How are you, sir?
I'm fine, ma'am. How are you?
Too good, sir. Thank you so much.
We are thankful to you for connecting us to such a wonderful speaker for today that we had in our webinar. The entire credit goes to you. Thanks a lot once again.
Thank you so much, Prince. Thank you so much, sir,
Yeah,
for
I would also
allowing
like to
that.
thank Zanita for giving me an opportunity by suggesting my name.
Exactly. She was the one
Yeah.
who told us that
Okay.
Garret will speak.
Uh-huh.
So thank you, Janita, once again. Uh,
Thank you, sir. Thank you, Garret, sir.
Yeah. Thank you,
hope
Zanita.
hope we'll be hearing some good news from your side very soon.
Mhm.
Sure, sir. Sure, sir.
Uh, Thank you. Thank you, Janita ma'am. Thank you, Garret sir, for being with us for a long, long time. It's 1.5 hours that you have been with us,
Yeah.
uh, giving all the answers to the queries raised by our students. It was a privilege having you to be with us today. Thank you, and we would like to meet you again someday physically if you ever come to Calcutta or West Bengal.
Yeah. Sure, sir.
We'll definitely try to host you. We will host you, in fact, and we will definitely meet online once again. You have a
Definitely,
range
sir.
of yes, you have
Yes.
a
Yes.
range of topics, interesting topics to
Yeah.
discuss
Yeah. Sure.
very soon. Thank you all the students for patiently listening to this. I hope you have learned a lot. With this, we come to the end of our webinar. Thank you. Good night. Have a nice sleep. Thank you everyone for joining in. Thank you, sir. Thank you, Janita. Thank you.